My name is Mika Nonoyama, and I'm in the Faculty of Health Sciences at Ontario Tech University. So this research is testing different extremes of weather conditions and temperature and humidity for individuals who have chronic lung disease. So we know that when the weather gets extreme, too hot, too cold, oftentimes the news outlets or social media will tell people who have chronic lung disease they should stay indoors. But this usually forces them to limit their activities of daily living and go outdoors and do things that they were planning to do. So we wanted to see if we can test what happens when they go into these weather conditions and eventually maybe give them some different types of strategies to help with these conditions, because as we know, with climate change, these types of weather extremes are becoming more and more common. So I chose the ACE Core Research Facility because it's one of a kind. Things that we do with respect to research is we want to control as many factors as possible. And the weather isn't something we can actually control very easily, but here at ACE, I was able to, together with the staff, modify the temperature and the humidity levels in order to fulfill the different research objectives. So in the small chamber, we did various testing. We did walk test. They also measured different symptom levels as well. We also did some breathing tests, and the participants wore a belt around their chest to measure continuous physiological measures like heart rate and core temperature and things like that. And we did that in 5 different weather conditions, sort of an ideal. We did hot with high and low humidity and very cold with high and low humidity. I'd say the biggest challenge, other than the fact that we were doing it at the tail end of the pandemic, was finding the right balance of temperature that we could modify the humidity and mimic the real world, but also work with the ability of the chamber itself so things didn't just completely freeze over as well. So it took a bit of time in order for us to find the ideal type of temperature and humidity level in order for us to do the testing in the amount of time that we needed. With the help of the engineering team at the ACE Core Research Facility, they helped us with trying to figure out how to modify the temperature and the humidity in an ideal kind of way, especially in the cold, so things didn't freeze over completely. But we also wanted to make sure that there was enough time to do the testing before the temperatures would be changed. We wanted to keep things quite consistent. In the future, we can test some kind of pollutant as well, because we know that really is a major factor in climate change for chronic lung disease. And I know that the staff here will definitely help with that.